Hello everyone, and welcome to the Teach, Lunch and Learn webinar series on Pregnets, a tool on quitting smoking and pregnancy. Today's presenters are Dr. Nadia Minian and Jessica Penner. If you are interested in obtaining a letter of completion for today's webinar, you must have completed the pre-learning assessment and registration form. You must sign in to view the webinar session live using your first and last name. And following the webinar, we will be sending everyone who logged in today and completed the pre-learning assessment the link for the post-learning assessment. These webinars are being live tweeted on Twitter. Follow the CAMH Nicotine Dependence Services on Twitter at @PSQuitSmoking. To follow the live tweeting or to post your questions or comments, use the following hashtag #TeachWebinar. So Dr. Minian is a knowledge translation and evaluation scientist at the Nicotine Dependence Services, NDS, at CAMH. Her work ensures that NDS is continually striving towards delivering the highest quality and most efficient services possible so that the best outcomes can be achieved for Ontario smokers. She uses a utilization-focused and participatory approach to evaluation to build the capacity for sustainable evaluation and knowledge translation activities. She likes to work in collaboration with communities, researchers, and policymakers to promote health equity and improve the health system. Jessica Penner is a knowledge translation coordinator at the Nicotine Dependence Service at the Centre for Addiction and Mental Health in Toronto. In this role, she works in knowledge translation research, evaluation, and program design and implementation. She also has experience in systems planning, education, and community engagement, and in the fields of addiction and mental health, food security, agriculture, and community economic development. There are no disclosures to report. The TEACH curriculum and slides were developed and compiled with funding from the Government of Ontario, Ministry of Health and Long-Term Care. Content of slides are primarily based on evidence-based guidelines, including the following sources. Development and delivery of the TEACH curriculum is not influenced or funded in any part by tobacco industry. TEACH does not receive funding from the tobacco industry. Development of the TEACH curriculum has not been influenced by pharmaceutical industry. Information presented on pharmacotherapy refers to generic products only, and recommendations are based on existing research, including the Canadapt and US guidelines. These materials and any other materials provided set out only general principles and approaches to assessment and treatment pertaining to tobacco cessation interventions and do not constitute clinical or other advice as to any particular situations and do not replace the need for individualized clinical assessment and treatment plans by healthcare professionals. Okay, so I'm going to pass it over to our presenters now.
Thank you very much for that beautiful introduction. So we have 4 main learning objectives for today. And the first one is to share with you some of the effects smoking causes for pregnant women, as well as for the fetus and the baby once it's born. The second one is to describe who in Ontario is pregnant and smoking and some of their characteristics. The third one is to explore how Pregnets, which is a website that we have developed here at CAMH, can be used by healthcare professionals as well as by pregnant women who are smoking to help them quit smoking. The fourth objective of today's webinar is to really mobilize practitioners to start talking to their pregnant patients about smoking and if they need to utilize Pregnets and refer their clients there. So as most of you know, in Canada, there's been huge progress in tobacco control. But unfortunately, tobacco is still killing about 37,000 Canadians each year. And if we look at the evidence, this is not surprising, given that tobacco smoke usually affects every single organ in our body. And for women in particular, it causes some problems linked to menopause and to pregnancy. So when the pregnant woman smokes, not only is she more likely to develop a lot of cancers and heart attacks, but she's also putting her pregnancy at risk. For example, there's a lot of evidence showing that pregnant women who smoke are at increased risk of vaginal bleeding, of placenta previa, and of stillbirth, as well as spontaneous abortion and perinatal mortality. Unfortunately, smoking also causes preterm birth and low-term birth babies, which is a huge priority for the Ministry of Health and Long-Term Care, as it's causing a huge burden to both the financial and health of Ontarians. The effect of smoking is also quite considerable once the baby is born. So the babies who are exposed to secondhand smoke are at increased risk of sudden infant death syndrome. And depending on the research you see, it increases your chances by 2 to 5 times. It also decreases the likelihood that a woman will be able to breastfeed her baby successfully, as both the quality and the quantity of the breast milk is reduced. It also increases the risks of orofacial clefts in the infants and doubles the risk of infants developing bronchitis or pneumonia. Children that live in houses where there's secondhand smoke are from 200 to 400 times more likely to develop asthma and a lot of allergies. Children are also more likely to experience middle ear infection, and once they're a bit older, they're more likely to be diagnosed with ADHD. Fortunately, there's huge benefits once the woman quit smoking, and that is both for herself as well as for the pregnancy and the baby once it's born. So I'll go through this, as probably most of you know most of it, but within 8 hours, for example, of a woman quitting, her carbon monoxide levels drop in the body. Within 48 hours, her chances of having a heart attack start going down. And within 72 hours, her lung capacity has increased. So these are really short-term benefits that are increasing the woman's health quite immediately. Medium-term benefits for the woman quitting is, for example, within 2 to 3 months, their blood circulation improves, as well as their breathing is much easier. And within 1 year, her risk of smoking-related heart attack is already cut by half. The long-term benefits are very well documented, and within 10 years, the risk of dying from lung cancer is cut in half, and the risk of dying from a heart attack is equal to the person who has never smoked. So really huge benefits for quitting smoking for all women. For pregnant women in particular, this has even more benefits, as the fetus will also be more likely to have more oxygen and for their lungs to work better. The fetus will be more likely to be born on time and to have a normal birth weight and to be healthy once it's born. So who are the pregnant women in Ontario who are smoking? And that was one of the first things we did when we started our project. And when we looked at CCHS data, we saw that in 2008, about 10% of pregnant women in Ontario smoked. We knew that this wouldn't be distributed evenly throughout the province, so we went into the born data in order to see the different health regions and what was the prevalence of pregnant women smoking there. And as we can see, there were huge disparities. For example, in the Northwest, about 34% of pregnant women smoked, while in Toronto, about 5% of pregnant women smoked. However, our province is quite large, and these health regions are also really big. So we wanted to delve a bit deeper to understand who in Ontario is really smoking. And as we can see, even though in the Central East only 9% of pregnant women are smoking, when we look at Peterborough, it's 20% of pregnant women smoking. And the same is true for Eastern regions. So when you're looking at your region in particular, it's really important to be as specific as possible and to look into what area you want to work in as much as you can. When we looked at the age of the women who were smoking, we saw that pregnant women smoking were much more likely to be younger, so they were around, sorry about that. to be about 26 years old, while non-smokers were about 30, 31 years old. When we looked at the born data again, we saw that pregnant women who use any tobacco product while they're pregnant were less likely to have a formal education than those who did not smoke or who did not use any tobacco product. They were more likely to have asthma, more likely to use illicit substances such as narcotics, cocaine, and marijuana. However, we have to be very careful with this number because it was very few pregnant women who reported using illicit substances. So just even though there was a significance found, we have to be careful with the interpretation. They were also more likely to have alcohol dependence syndrome and to have a history of several mental illnesses such as depression, both before their pregnancy and during their pregnancy, and anxiety, again, before and during their pregnancy. And it's the same as what the literature has showed us. They were much more likely to have a baby that was considered very low birth weight or just low birth weight. The good news was that when we looked at how many pregnant women had tried to quit smoking, we saw that it was really high. 75% of pregnant women in 2007, 2008 had had at least one quit attempt. And this is compared to 49% of all of Ontario. Also good news is that there's been a lot of research being done on pregnant women who smoke. So for example, there's a Cochrane review on what are the best practices to help them. Within the Canadian context, we have the CanAdapt guidelines, and we have the work from our partners in BC on expecting to quit. All of these guidelines and approaches tell us that there's several things that any program helping pregnant women quit should take into account. The first one is that it should be a woman-centered approach. And this is really important because a lot of times it's very easy to focus on the pregnancy and on the well-being of the fetus and of the baby when we see a pregnant woman smoking. However, the literature tells us that if we focus on the health of the woman, the health of the fetus and of the baby will be taken care of. Reducing stigma is also a really important one, as there's a lot of stigma attached to smoking in general in our province, and in particular towards pregnant women. Relapse prevention is huge. Most women who quit smoking while pregnant start smoking once they deliver their baby. So helping them stay quit is a huge concern and of huge importance. Having a harm reduction approach is really important. As we all know, tobacco addiction is really hard to quit. And anything that can reduce the harm for both for the woman and for her pregnancy and for her babies is important to take into consideration. Having a partner and social support is very important too, given that a lot of the literature has showed us that once a partner quits smoking with the woman, the woman is much more likely to quit and to remain quit. So even though we know a lot, there's still a lot that we have to explore and learn. For example, the example that's shown here is that nicotine replacement therapy is known to work very well, but for women in general, it doesn't work as well as for men. And for pregnant women in general, there's not enough evidence to actually say whether it's effective or not. So now I'll pass it on to Jessica, who will be telling you about the website Pregnets.
Thanks, Nadia. So Pregnets is a website that was created here at CAMH and at the Nicotine Dependence Service, and it's a tool on quitting smoking and pregnancy. Pregnets stands for the prevention of gestational and neonatal exposure to tobacco smoke, and the goal of the website is to provide many many evidence-based strategies in user-friendly approaches. And these resources are not only for healthcare providers, but they're also directly for pregnant and postpartum women. What healthcare providers can expect from Pregnets. There is a complete literature review. We have academic articles, clinical practice guidelines, info sheets, as well as reference cards. Here on the right, you can see some of the info sheets, the smoking cessation effects on birth weight and withdrawal symptoms, and then also 2 of our references that can be downloaded and printed as you like. And then also we are going, I'll talk about it in a minute, but we will be printing them and providing them free of charge, the desk reference card as well as the patient resource card. And what women can expect from Pregnets, we have lots of information on tobacco cessation practices. There's a discussion forum where women can post questions, whether or not they are for peers, or they can be answered also by a tobacco specialist. And then there's also a personalized plan for quitting or reducing tobacco. So the history of Pregnets is that it was launched in 2008 with funding from Health Canada. And then it was relaunched again in 2012 after the funding had ended with Health Canada. And this was supported by ECHO with a new site design as well as lots of updated information and data. Then in 2013, an evaluation was completed, which I'll talk about a little bit more in a second. We also did an informal survey for dissemination, and then now we're moving into 2014-15 with project expansion and website updating. So the evaluation was completed by the Ontario Tobacco Research Unit, and some of the key findings that they found were that for both women and healthcare providers, it was useful. 75% of women and 60% of healthcare providers reported learning new information. Also, one of the main goals of Pregnets is to provide a non-judgmental, safe avenue, and this was found to be true from the evaluation. Then we also completed, just before I talk about this, we completed here this informal survey where we sent out questions to healthcare providers, finding out whether or not webinars like this, as well as more information on Pregnets, would be useful. So that we could use the information from the evaluation as well as from this informal survey to apply for funding for further project expansion. So some of the recommendations from the evaluation were that the discussion board was good, but increasing other opportunities for peer support would be really useful. It's saying there's an echo and a delay in the speech. Is there anything that can be done about that? No? Okay. Okay, so we lost connection, but I think we're back. Okay, yes, people are saying we're back again. Okay, great. Okay, so we're talking about the recommendations that came out of the evaluation. The evaluation also found that the information on the website was really great, but that the expected literacy was a little bit high for the population. There was also support for more information, so different types of information. There were suggestions such as different exercises that could be used to mitigate smoking, and they also were suggesting that maybe information on how a partner can help support a pregnant woman from, or help her to quit smoking. There was a need for more diversity in the graphics. adaptability on the smartphones, as well as the colors seemed a bit medical. And there was also suggestions that Pregnets could be used as a tool to help raise awareness. And lastly, suggestions that the internet may not be the best way to reach this population that might be smoking during pregnancy. And here's the survey again. This is the survey that we sent out to the Maternal Newborn Child Health Promotion Network that we were looking to find out who had heard of Pregnets and whether or not people would be interested in learning more about it through a webinar. Sorry about that. It seems like we have some connectivity problems. This session is being recorded, so it will be available afterwards for those of you who are interested. But I guess we'll just continue. So moving forward after the evaluation and the informal survey, we partnered with the Ontario Women's Health Network. And this partnership, we applied for funding at a couple different locations and were successful with CIHR receiving a dissemination grant. And then we also applied to Shoppers Drug Mart who have a Women Body Mind Spirit fund for projects like this. So with this funding, our current and upcoming activities we're going to be promoting, and we are promoting the website, as well as we're updating Pregnets and utilizing the recommendations of the evaluation. So for the promotion of the site, we've been using social media, webinars like this, and then we're also printing, designing, distributing, and promoting material that I had mentioned earlier, the pamphlet, a poster, desk reference guide, as well as a patient resource card. For those of you who might be interested in some of these free materials, we don't have them available just yet, but we will shortly. Please feel free to contact me and I will let you know when they will be available. As well, with the current funding, we're updating the Pregnets site. So one really exciting thing that we're doing is we've created a blog. So this is now part of the Pregnets website and can be accessed directly at pregnetsblog.com. And this is a blog written by women who are either thinking about getting pregnant, currently pregnant, or are recently postpartum, and talking about their experiences related to being pregnant and trying to quit smoking, or being successful in quitting smoking and how they did that. So currently we have 4 bloggers from across Ontario, and they are writing about their experiences, and it's a really good opportunity for other women to connect, as well as for healthcare providers to really see an unfiltered view into how these women are experiencing this situation. We also are in process of creating lower literacy text of the entire Moms and Moms to Be section. This section is all of the information that applies directly to women. And then we're also updating the latest research, and this is for healthcare providers. So there's new articles that are being posted as we see them. And so if you're interested in some of the latest research, please go and check out the site. So next we have Catherine Wallace from RNAO, and she has been partnering, or RNAO has been partnering with Pregnets to help promote evidence-based strategies for women who are pregnant and trying to quit smoking, and they have some resources that they'd like to share with everyone on the phone. So I will pass that over to Catherine. Should we change the...
Thanks very much, Jessica. Hi, everyone.
I'm Wallace, and I'm the program manager for smoking cessation here at RNAO. I'm currently working on a project for pre and postnatal women and smoking cessation. And we are delighted to be able to have the opportunity today just to highlight some of the new resources that we have here at RNAO. For those of you not aware of RNAO, it's the Registered Nurses Association of Ontario.
Catherine?
Yes.
Hi there, sorry, it's Tanya from Teach Project. I don't think you have enabled your microphone or webcam on the computer. Just click on them to make them green so that everyone can see and hear you on the computer as well as the teleconference.
I believe they are both green. Actually, maybe we can just check and see if our audience can see and hear me. Yes, I think we're okay.
Okay, they can hear you, but they can't see you. But that should be okay. Okay, sorry about that. Continue, Catherine.
Okay, thank you. So as I was saying, the Registered Nurses Association of Ontario is an association that represents nurses in the province and promotes nurses and the work that nurses do here in Ontario. So this pre and postnatal women and their families and smoking cessation project is part of RNAO's Smoking Cessation Initiative, which we've had since 2007, and this is an expanded component. And one of the components of this project is to create resources to raise awareness. And so we wanted just to share with you today just a few of these resources that are available. And just like Pregnets, these are available at no cost and can be ordered through RNAO's online store. And we have the email contact for you on each of these pages. So first we have these two wallet cards that we're very excited about. These were developed in collaboration with Smokers Helpline as well as with the Mother Risk program at the Hospital for Sick Children. These wallet cards, one is geared to the pregnant woman, as you can see, and the other for a new mother, and does include content reflective of impact of smoking during pregnancy, with breastfeeding, has content pertaining to NRT, both for pregnant and lactating women, and then also some discussion of the impact of second and third hand smoke during pregnancy and for postpartum as well. So these are available through RNAO and are intended for healthcare providers as a starting point, perhaps for a conversation regarding smoking cessation or harm reduction, and then as a resource that a client might have be able to take home and read through. Then we also have these two resources. These are brochures that were developed and intended for clients. So one is looking at 8 tips for smoking cessation for pregnant and postpartum women. And the other is for women who have had their babies and are wanting to not have a postpartum relapse, and some tips and suggestions for helping them with that. And we also have a poster series. So we have 3 posters that are available either individually or as a series. And these we were thinking could be used in clinic settings as a way of, again, starting a conversation with clients regarding smoking cessation. They all carry the same tagline of, I want to be tobacco free because I matter. So taking that woman-centered approach, which is consistent with the evidence. So we have 3 women featured, 2 of whom are pregnant, one who is speaking about the importance of a healthcare provider's support and peer support, and the other woman who is taking a harm reduction approach to her cessation plan. And then the poster in the middle is a woman who's had her baby, is breastfeeding, and she's wanting to remain smoke-free both for the benefit of her health and her baby's. So again, all of these posters and resources are available through our RNAO online store. Finally, we just wanted to make you aware of some upcoming events that we're having to promote knowledge transfer. So we have a workshop series, and we will be in the Owen Sound area next week on the Wednesday, and then on the Friday next week we will be in Barrie having these workshops. These are full-day workshops available at no cost. Do require you to register in advance. But at these workshops, then you have the opportunity to receive these resources that I've described, as well as access quick kits and other materials, as well as a discussion of local issues that's pertinent to the populations that we'll be in. Also to make you aware, then we do have workshops then upcoming in the new year in the Kingston, Cornwall, and Toronto areas. And again, if you're interested in those, you can see there is a contact there, Sarah De Silva, who's the project coordinator, who can help you with registration. We also have a webinar series, just like Pregnets as well. And we have on November the 13th, we have Roberta Ference, who's going to be speaking from the Ontario Tobacco Research Unit. And she's going to be speaking on the impact of smoking for not only mom's health, but for the fetus, for the infant, the child, and into adulthood. What is that impact long-term beyond just the pregnancy, but for that child's lifetime? So we hope that you will join us for that. Just like this webinar, it is available at no cost between 12 and 1 o'clock. And again, you can see the contact information there. So we want to just thank Pregnets for the opportunity just to highlight these resources and workshops and webinars. And certainly if you have any questions for us, certainly we have an opportunity hopefully today. Otherwise, you can reach us through our the email addresses listed there and through our tobacco-free RNAO website. Thank you.
Do you want to join for?
I think there's a few more slides, right?
No. No questions.
Oh.
Yeah. Great. So now we're going to enter the question period. Feel free to type in your questions, and we'll try to get as many as we can. If anyone on the teleconference line has any questions, just push *1 on your phone to unmute your line.
So I see there's a question already. I was wondering about the use of NRT in pregnancy or breastfeeding. And as I mentioned in my talk, there's very conflicting information and results from different studies on whether NRT is effective to help pregnant women quit smoking. One of the last studies I read came from France, and it was a quite good randomized controlled trial showing that actually NRT was not helping in any way pregnant women quit smoking. This is not a conclusive study, but it was one of the latest studies. So there's a huge need to understand more whether it's the dosage that's not being effective or how we can help pregnant women quit smoking with or without using NRT. Usually the guidelines do refer that the first step should be more psychosocial approach where you talk to the woman and try to help her that way. I hope that was useful.
I also noticed a question that went by a little while earlier asking whether or not Pregnets had an app. And we unfortunately don't have an app at this point, but that is on our agenda moving forward as we start to decide what the next stages are and how we're going to get funding to move forward with them.
Catherine, is there anything else you would like to add about NRT and pregnancy?
It is something that we discussed during our workshop, and it's something that we talk about in terms of dosing, just as you've indicated, what is the recommended dose and titrating that dose. So it is, as I say, something that we would cover during the workshop. And there is some information as well on the wallet cards too. Thanks.
There's suggestion. We will share the article that I talked to you and all the articles that we have on NRT studies in pregnancy. You can also see them in the Pregnets website, but we'll be sure to share that with you. Could any of the presenters speak to the NRT spray and its alcohol content? Unfortunately, I can't. I don't know if Catherine, you know about this? An NRT spray as a cessation for pregnant and breastfeeding women?
Yes, it is, for some care providers, they will not use the spray for that reason because of the alcohol content, and instead might use other intermittent sources such as the gum and the lozenge instead, and then consider the patch last.
Thank you. Is the patch safe during pregnancy if she decides to use it? Again, it would be recommended that sorry about that. We seem to have a lot of connectivity issues today. So the question was whether the patch was safe to use during pregnancy. And again, there's a lack of information about the safety. It seems to be safe, but the recommendation is always to talk first to the healthcare provider. And the question is more whether it will be effective in helping the woman quit smoking. What about Syban and pregnancy? Actually, first, Catherine, is there anything you would like to add on that? Okay, hopefully she hasn't lost connectivity. But what about Syban and pregnancy? Again, it's not something that's usually recommended as a first step, but as a last step. After trying psychosocial interventions and NRT, sometimes it is recommended Syban, but not usually. So again, it depends on the healthcare provider. And Julia has just mentioned that many of these questions are addressed in the Teach Frequently Asked document, and she provided the link, so you can see the responses there. Another question is asking if there's a recommendation to breastfeed or not if the woman is smoking. And the recommendation is to continue breastfeeding with a few tips on when to smoke in order to reduce the amount of nicotine that the breast milk will have. And again, you can see those recommendations in our Pregnets website, and I'm sure in RNAO's resources. But yes, the recommendation is to continue breastfeeding as much as possible. So another question is whether we meant placenta previa, if placenta previa was a risk of smoking. And yes, it is, and we can send the reference. Probably we'll have the reference for that in this presentation, but we can send it separately so you can have it. Sorry again, we seem to be having a lot of connectivity issues, so you are losing us, and there's not much we can do on this end, so just I apologize on our behalf.
Nadia, it's Catherine at RNAO. I did see just a couple questions, I think that were pertaining to RNAO. So someone asked whether the webinar that we're having next Thursday will be recorded, and yes, it will. It will be part of our speakers bureau if someone is unable to attend. So they can certainly check our Tobacco Free RNAO website for that in the future. Someone else asked about quick kits. Those are meant just for the participants who attend the workshop. We're not currently shipping those just due to the cost of that. But anyone that attends the workshop can have up to 5 quick kits that are intended for their pregnant or postpartum clients. And then in terms of cost of material, yes, there is a cost just for shipping, and that varies depending on the materials that are ordered, but otherwise the materials are free through our funding through the Ministry of Health and Long-Term Care. Thanks.
We got a request just to repeat that answer. I guess there's a bit of audio quality issue. So Catherine had said that yes, the webinar next week will be recorded. And then she also was referencing that the question about whether or not there was a cost associated with the materials that they were providing, and the cost is the shipping costs, which are, I think she said, $3. There's a question here about, are we tracking the number of hits on the blog to measure the reach? And yes, we are. That is part of the blogging service that we have. Currently, I think we've had about 1,600 views of the blog, if I'm not mistaken, and that's since it launched on September 9th. And then daily, we're getting somewhere between 20 and 30 views, I think. So yeah, the reach seems to be relatively good, and so far there are about 50 to 55 people that are following the blog and receiving updates every time we post a new post. If anyone is interested in following the blog or checking it out, definitely do so. Another thing I wanted to mention was that we've recently, we're taking applications for our next group of bloggers, which will start in January. So if anyone knows any women who might be applicable, whether or not they're thinking about getting pregnant or currently pregnant or recently had a baby, and also working to either reduce their smoking or quit smoking, we'd love to chat with them. We have an online application that if you send me a quick email, I can send you the link to find that. My email will come up again on the last slide.
Line unmuted.
Hi, it's Catherine.
Hi, it's Catherine here again from RNAO. I just noted there's also one question asking if you need to be a nurse to order materials from RNAO. And to be very clear, no, absolutely not. Our materials are intended for nurses as well as other healthcare providers, and we very much welcome the distribution and dissemination of our materials. So please, if you think that that would be valuable for your clients, whether you work in dentistry, in pharmacy, in midwifery, as a physician, please feel free to order our supplies. Thanks.
Line muted.
Yes, just to be sure that everyone heard that. Sorry about these technical difficulties, but Catherine had mentioned that all of the materials are available to all healthcare providers, not just nurses, and that they encourage other professions to also order the materials.
So there's a question whether physicians have much impact on encouraging pregnant women to quit smoking, and the answer is a resound yes. And not only physicians, but healthcare providers in general. Once healthcare providers ask the woman whether they smoke, and as long as they're doing it in a non-judgmental way where the woman will feel safe to disclose the information and receive some feedback on how to quit smoking, it has a profound effect on the woman quitting smoking. So we do encourage all healthcare providers to talk to the woman about whether they smoke, and if they do smoke, encourage them to quit smoking in a non-judgmental way. And again, there's resources within Pregnets on how to do this.
There's a question, or did you want to ask Catherine to follow up on that? Or?
Catherine, is there anything else you would want to add?
Line unmuted.
Really just to
echo your comments, I think the importance really of it being non-judgmental, of being supported. I think when women feel guilty and criticized, blamed, shamed for smoking, that it really can be quite counterproductive. But otherwise, yes, that support can be very invaluable to their cessation attempt.
Line muted.
There's a question about whether or not you can access the blog from the Pregnets site, and excuse me, yes, you can. There is a button at the top of the site that says blog, and so you can click on that and it links directly to the blog.
Could you please further describe the first line of intervention for smoking cessation with pregnant women? Perhaps explain the psychosocial intervention a bit more. And that would be something very similar to the 5 A's or the 3 A's, where you ask the woman whether she smokes, and if she does smoke, you talk about some of the harms that are well documented in the literature, again, being very careful of not being judgmental, to trying to understand her perspective on why she smokes, what she can do in order to reduce her harm, both for herself and if she's pregnant, for the baby or the fetus. So that would be the first line, exploring different times when she smokes, different reasons why she smokes, and what alternatives could she do in order to do that, so in order to quit or reduce her smoking. So for example, stress is mentioned quite a bit, so offering techniques of reducing a woman's stress that are not related to smoking is usually quite beneficial. Is there anything else you would like to add on that, Catherine, before we move to the next question?
Yes.
Yes, the importance of partner support also,
as well as the ongoing support, recognizing that cessation is not a singular event, but a journey. So encouraging the woman to come back and talk more about her cessation attempts, about her slips, relapses, keeping that door open so that she knows that she can come back and talk to you is probably the most important takeaway.
There's another question. Many pregnant women are referred to us by the physician, but they do not show up to their first appointment. Other service providers are observing this. Are other service providers observing this? And that, I guess, is a question for everyone in the call. And then they ask whether there's any strategies to reach them. And they clarify that they're an addiction agency, so they might be afraid to do so because of the stigma. And it could be due to the stigma. It could also be due to their lack of time, of whether the addiction agency is far away from them. A lot of women do not have the resources or the time to travel far away for specific appointments. Stigma is also huge, so being pregnant and going into an addiction agency might be a huge deterrent. I don't know if anyone else would like to add to that. Catherine?
I agree.
Certainly, I think many women don't use the nicotine as an addictive component, and
so may not
identify as having an addiction.
So is
part of the
barrier
that the woman is not aware that this is the type of service she's accessing and doesn't identify that.
Perhaps
or perhaps it's
not ready yet.
not ready yet to take that step, and perhaps it's
being
the
appointments being made
before she's really ready to take that next step.
There's a question regarding the Pregnets blog and app and the literacy levels and whether or not we have considered providing the support in other formats like videos or podcasts. In terms of the blog, I think we're sticking mostly to the typical blog format. Some of the women are choosing to remain anonymous on the blog rather than posting their videos of themselves. But they are trying to incorporate other media into their blog posts in order to sort of reach a wider audience, referencing different videos, using pictures and things like that. In terms of the website, we haven't moved in that direction just yet, but there are many teach videos that I can't speak directly to that might be in this. Do you know about that? But no.
I can share the Teach YouTube page to everyone in a follow-up. I'm not sure of the specific videos, but I can definitely share our YouTube page, and you can feel free to look at the different videos that we have there.
I do think that is a great suggestion in terms of moving forward, though.
Could you
Yeah.
Catherine, there's a request for you to repeat your answer, and sorry, I can't remember it, so I can't do it for you.
If you could, Catherine, if you could turn on the microphone on your computer, I think that could be why people are not able to hear you.
Line unmuted.
Okay, hopefully they can.
Okay,
So
hopefully
the
they
question
can hear me now. So
might
the question was in regards to why a woman might not seek out
and
an
my thoughts
addiction
were
service.
ready.
And my thoughts are perhaps the woman isn't ready to take that next step, perhaps
forced on her,
it's being, I don't want to say
the woman
forced
hasn't
on her, but the appointment's been made
really
and the
agreed
woman
to,
hasn't really
perhaps
agreed to
also
it.
justify
Perhaps also she doesn't identify as
addict,
smoking as an addiction or herself as an addict and doesn't feel
congruent
that
with who
that's
she is.
congruent with
Perhaps
who she
it,
is.
perhaps she would have felt
Perhaps it's,
comfortable spending more time
perhaps she
discussing
would have
the
felt more
position for
comfortable
care
just spending
provider
more time
before
discussing
being
the
made to
position
that,
for care provider
referral.
before being made to that
Line muted.
So just in case people didn't hear that, Catherine was mentioning that it's possible that the women that have been referred to the addiction agency may not be ready to actually treat that addiction in that way, and so it might be they might just not be ready for it at that point. Yeah, I think that's the summary. Okay.
And I see Myra has shared the YouTube link for Teach, and that includes some videos on motivational interviewing, which is huge for most healthcare providers who are talking about smoking in general and to pregnant women in particular. So thanks, Myra, for doing that. So there's a question of whether there's any online services that can assist with therapy part of care for those that are unable to access regular services. And I would say Pregnets could be one of the avenues to help pregnant women to quit smoking. And that's because we have a discussion board. We try to answer within 24 hours, except within the weekends. So pregnant women can post there anonymously and receive some support. There's also smokers helpline where they can call and get support over the phone. And I think they have a text messaging services. I'm not sure if it's specific for pregnant women or for smokers in general. So there are several options available. None are ideal, but they're much better than nothing. Is there anything you would like to add to that, Catherine?
I would just agree about the access to the smokers helpline services. I think for someone who is not necessarily comfortable with face-to-face, perhaps, that they may feel comfortable reaching out to smokers helpline, or just to be able to talk and be able to pick up the phone and have that conversation.
Line,
I would just agree.
Yep. Okay, hello again, everyone. Thank you, Nadia, Jessica, and Catherine for a very informative session. If you have any additional questions, please do feel free to continue typing them into the chat box, as I will send all questions off to our faculty following the webinar to have them answered for you. Alternatively, you can even email me your questions directly, and the email address is on the side menu there. Okay, so remember, a link to the post-learning assessment, which is a requirement for the letter of completion, will be emailed out to everyone either today or tomorrow, and you will have 1 week to complete the assessment. If you participated as a group today, please do be sure to email me with a list of the participant names as well as emails by end of day today. Our next Lunch and Learn webinar series is coming up very shortly, in about 2 weeks, on November 26th. And the topic is the STOP program, an example of evidence-informed practice in smoking cessation. The instructors will be Dr. Lori Zawratao as well as Aaron Cameron. Applications for this are now open through our website. Great, thank you everyone for attending. Thank you again, Catherine, for joining us from RNAO, and thank you to our instructors today, Jessica and Nadia. Great, thank you everyone.